Doctor explains. 7 drinks to lower blood pressure quickly. Hello everyone, and a very warm welcome back to the channel. It's so wonderful to have you with me again. For anyone new here, this is our community where we explore practical, science-backed ways to manage blood pressure and support our overall heart health. Today, we're diving into a topic that I know many of you are curious about: simple, actionable steps that can make a real difference. We'll be exploring the 7 specific drinks that research suggests can help lower blood pressure quickly. So, get comfortable, and let's get started on this important topic together. 1. Skim milk. As a key component of the DASH diet, a science-based recommendation for treating high blood pressure, low-fat dairy products like skim milk and yogurt are highly beneficial. Skim milk contains essential minerals, including potassium, calcium, and magnesium, which are all well known to help decrease your blood pressure. Furthermore, important studies have shown that simply drinking 1 to 2 glasses of skim milk each day can effectively help decrease blood pressure over time. This positive change is especially the case for people who are 55 years old or older. And these results can happen in just 4 weeks. 2. Tomato juice. Growing evidence suggests that drinking just 1 glass of tomato juice each day may actively promote your overall heart health. Tomatoes contain powerful and beneficial antioxidants, most notably lycopene, which has been scientifically shown to have several different health benefits for the body. For instance, one significant scientific review found that regular tomato juice consumption effectively decreased systolic blood pressure, which is the top number in a reading. Researchers observed this improvement when people aged 55 and older drank 200 milliliters daily, or a little less than 1 cup, over the course of an entire year. To avoid unnecessary sodium, always buy unsalted tomato juice. 3. Beet juice. These colorful, low-calorie vegetables contain a host of health-promoting vitamins, minerals, and plant compounds, which may help to significantly lower your blood pressure. Specifically, beet juice contains beneficial nitrate that can improve blood flow throughout the entire body. A notable clinical trial showed that when participants drank a little more than 2 cups of beet juice once a day, their blood pressure effectively decreased. Beet juice can help lower blood pressure almost immediately, as the drop in blood pressure can happen as soon as 30 minutes after drinking. This impressive and powerful effect can then last for almost 24 continuous hours. 4. Hibiscus tea. Hibiscus tea contains the beneficial antioxidant anthocyanin and may help decrease blood pressure. According to limited research, drinking 2 cups of this tea daily for at least 2 weeks can be effective. However, most studies typically examine the effects after 4 weeks, so its exact speed is unclear. The research on its immediate impact is currently conflicting. For example, some studies suggest it can take effect in just a mere 1.5 hours, while other studies saw no discernible effect up to 4 hours after consumption. A discrepancy possibly due to anthocyanin variations. 5. Pomegranate juice. Like hibiscus tea, pomegranate juice contains beneficial anthocyanins and may also interact with a key enzyme involved in blood pressure regulation. Small studies showed that daily consumption for at least 2 weeks successfully lowered participants' blood pressure. The exact amount of the juice needed for this effect remains unclear, although some notable research was based on a dosage of at least 8 ounces. While the data is admittedly mixed, many prominent researchers currently agree that pomegranate juice can help decrease your overall blood pressure. 6. Tea. Teas are the second most common drink for humans, right after water. Green tea, which has been enjoyed for many centuries for both its pleasure and its well-known medicinal purposes, uses fresh, dried leaves from the official Camellia sinensis plant. In contrast, black tea differs from green tea because its tea leaves have been fully fermented. A 2020 literature review that analyzed randomized controlled trials compared the effects of black and green tea consumption on blood pressure. The researchers reported that consistent, long-term intake of both types of tea lowered both systolic and diastolic blood pressure readings. However, the reduction was notably more significant for green tea. The active chemicals in tea might achieve this by relaxing blood vessel muscles, reducing hormones that raise blood pressure, or increasing nitric oxide, which opens blood vessels. 7. Cardamom tea. Cardamom, which is derived from a fruit, is typically used as a common spice. However, it is also popularly used as a tea in many cultures. If you perform a quick internet search, you will find numerous online articles that tout the powerful effect of cardamom tea on lowering your blood pressure. One small, specific study was conducted to officially test that very theory. The results of this study found that cardamom tea does, in fact, reduce overall blood pressure. The study also found that it improved blood clots in the body as an additional health benefit. Does drinking water help lower blood pressure? In addition to the 7 drinks that help lower blood pressure, many people ask an interesting question: does drinking water help lower blood pressure? To answer this common query for you, we have a separate, detailed explanation video. For more information, please go to our full video list and search for that video. Other tips for lowering blood pressure. In addition to making careful drink choices, there are several other crucial steps you can take which can help to significantly lower your blood pressure and actively support your overall heart health. First, it is vital that you limit your sodium intake. Consuming high amounts of sodium, which is often found in many processed foods, various salty snacks, or from other sources, can directly cause an increase in your blood pressure levels. For this very reason, the American Heart Association has a strong recommendation. They suggest ideally not consuming more than a total of 1,500 milligrams of sodium each and every day, for optimal cardiovascular wellness and blood pressure management. Furthermore, it is important to follow a nutritious and well-rounded diet plan. Eating lots of fresh fruits, healthy vegetables, and whole grains can help increase your daily fiber intake. This also ensures you are getting all the essential nutrients that you need to support and maintain healthy blood pressure levels for the long term. Regular exercise is another key component. Consistent physical activity helps to strengthen your heart muscle, and it also makes it much easier to reach or to keep up a moderate weight, which in turn could lower your blood pressure. You should aim to get at least 150 minutes of moderate intensity aerobic exercise every single week, which includes beneficial activities such as jogging, running, or cycling. Finally, if you currently smoke, please strongly consider quitting. While the exact relationship between smoking and chronic high blood pressure is still being fully investigated by health researchers, we do know that every time you smoke, it causes a temporary increase in your blood pressure. Smoking also causes arteries to narrow, which greatly increases the risk of a heart attack and stroke, especially if you already have high blood pressure. So, to quickly recap, we've explored 7 powerful drinks that research suggests can help lower your blood pressure quickly. We discussed the benefits of skim milk, unsalted tomato juice, potent beet juice, and antioxidant-rich teas like hibiscus, pomegranate, green tea, and cardamom tea. Remember, making small, consistent changes to your diet is a powerful step towards supporting your long-term heart health. Every healthy choice matters. If you found this information valuable and want to continue learning practical, science-backed ways to manage your well-being, please take a moment to subscribe to the channel. And to make sure you never miss our future updates, be sure to also click that notification bell. That way, you won't miss out on important health information that can support you on your journey. Thank you so much for watching. Stay healthy, stay informed, and I'll see you in the next video.